Hey everybody, I hope you're all doing well, and welcome back to Michael's Matters. And I, of course, am Michael. And today we are doing an off-schedule video because we got some pretty amazing news today about Medicare costs. In fact, the fact that they are going to be going down in 2023, which is pretty much the only time, maybe the second time in the last 20 years that this has really happened. So there's times where it's gone flat, but this is the first time in the last 20 years or so it's gone down. This, of course, is great news for seniors, for retirees, for folks on Social Security benefits. So that could be Social Security retirement, Social Security disability, SSI, railroad retirement, VA benefits, for all those folks who do utilize Medicare for their health care. So today, we are going to talk about what is the new Medicare Part B premium for 2023, how this new lower monthly price will help seniors to make the most out of their COLA increase for 2023, so it goes a little bit farther than it would have otherwise. And ultimately, we're going to talk about why it actually went down. Now, this is Michael's Matters. And before we get to it, if you like these videos, if you find them interesting, if you find them helpful, if you at least find them useful, please don't forget to like and subscribe and to hit that notification button bell so you can get updates when my newest videos come out. All right, now let's get down to it. All right, so today, let's start with the big news for those 64 million older Americans who are currently on Medicare and who got hit with a massive Medicare Part B increase this year. So for 2022, I think it was at 14.5%. Ouch. So the good news is that this year, it's actually going to go down. So for 2023. Right now in 2022, so again, this year, the monthly premium Part B is set at $170.10 for most beneficiaries. Now, it does change if you are a higher income person, but for the most part, we are talking about the majority of seniors here. Now, that $170.10 was up from the previous year at $149, so that is in 2021. And that jump, I think we can all agree, is a preposterous jump. But for 2023, just released from CMS, and that is the Centers of Medicare and Medicaid Services, they came out and said that for 2023, it will actually decrease by $5.20 down to $164.90 a month starting January 2023. The reason for this drop is primarily as a result of a stupid big increase Medicare beneficiaries got this year because of the anticipated approval of an Alzheimer's drug called Aduhelm, which had a cost of roughly around $50,000 per year per user. So that was going to be eventually factored into the cost of Medicare Part B. It was factored in for 2022 and was passed on to basically everybody else who was part of the Medicare program. But as of right now, as of today, as of date, in fact, it has not been approved for general usage for seniors through Medicare. And so without this prohibitively high cost factors factored in, it's easing the upward pressure on the Medicare Part B program. Hence the reversal of the full increase from the 2022 now into 2023. So undoubtedly, this is good news for Medicare beneficiaries. I mean, for a couple reasons. First is that it means that they will not have to pay more for the Medicare Part B premiums. Yay, right? But also because it'll mean that the yearly cost of living adjustment, or that COLA for 2023, is going to have a much bigger impact on their monthly benefit in a positive way. Even right now, as the COLA for 2023 will likely be one of the biggest increases in the last 40 years, and it'll probably sit between 8 and 9%. We don't know exactly yet, but it's looking on the higher side. If we compare the overall prospective cost of Medicare and the increased COLA from 2022 to 2023, it'll mean that seniors will see a significant increase in cash monthly starting January. So let's take this example. If the average beneficiary in 2022 is getting the average Social Security check of $1,666.90, and the Medicare Part B premium is at $170.10, that means that just the Medicare Part B, not including the Part D or any of the actual medical expenses that you would use, but just that status quo monthly Part B premium takes up around 10.2% of a monthly benefit. At $170.10, that leaves $1,496.80 left in the average person's Social Security benefit in 2022. Now let's compare that to an estimate for 2023 and see what the difference is. So if we did in fact get an 8.7% increase, like the Senior Citizens League is anticipating in the COLA for 2023, then the average check of $1,666.90 would go up by $145.02, putting the 2023 average monthly check at $1,811.92. With the decrease in the Part B premium for next year to $164.90, that would mean that after the Part B costs are taken out of the monthly Social Security benefit, that would mean that would still leave $1,647.02 left. So when we compare those monthly costs after the Medicare Part B is taken out for 2022 to 2023, we can see that the average beneficiary will actually come out with an additional $150.22 a month in their pockets, or really truly an increase of 10.04% over the previous year's monthly basis. So that, it looks pretty good. Now, to add on to this last part of the healthcare portion for folks on Social Security in 2023, early this year we got more good news that the average cost for the Medicare Part D premium, that is the portion that covers prescription drugs, is also going to decrease. So to add this number to the mix, we can see that the average Medicare Part D premium in 2022 was at $32.08. Now in 2023, it's only going to be $31.50. So a decrease of 1.8%. So when we compare the new and the old Part D premiums to what the average Social Security benefit was, we can see that in 2022, the actual Part D premium represented 1.92% of someone's Social Security benefit. But in 2023, it'll go down to 1.74% of the total average premium. Ultimately, when we put the full change in the cost for both Medicare Part B and Part D for both 2022 and 2023 side by side, we can see there is some real change, or should I say an increase in the average Social Security benefit that's left over when there's an 8.7% COLA that actually rose by 10.3%, or $150.80 a month. And so this is primarily because, like you can see, the decrease in the Part B and the Part D, as well as the increase in the COLA of, let's say, 8.7%, but that can vary as well. So again, overall, that puts a lot of additional money in the pockets of seniors, and that again is very good. Now, of course, there is a caveat to this calculation because, well, the reality is that basically nobody is average. Nobody gets these average numbers. The number of people who are actually at this number is super duper minimal. But the majority of people will probably be below this number, with a few people who have larger Social Security benefits to throw off that average. So when we look at numbers of people-wise, a vast majority of folks are going to be getting Social Security checks that are under that number. And in this case, on a case-by-case basis, when that goes up, it means that their Part D and Part B portions are going to have a different overall effect on those lower-income seniors more than on the higher-income seniors. Also, the Part B premium is standard pretty much everywhere in the country, assuming you don't make a lot of money, and that's when it goes up. But the Part D premium, it can actually vary pretty dramatically depending on where you are in the country. So that's another factor that's not going to be factored in here. All right, so that's it for today, and I just wanted to do a quickie because I thought this news would be really great to get out there and share with the community to at least give a little bit of hope of things to come that, it's not a huge percentage difference, but it is an increase, and that is a few dollars in the pockets of our friends and our neighbors and our family members who rely on Social Security as well as Medicare to survive. Now, this has been Michael's Matters, and I hope that you found it interesting. I hope that you found it helpful, and I hope that at least you found it useful. And if you did, please don't forget to like and subscribe. That way you can get updates when my newest and most informative videos get put up. So for Michael's Matters, I'm Michael, hoping that you take care of yourself, take care of others, and have a happy, healthy